Hi everyone, this is Julie Joby from Bright International Education. In today's video, I will be explaining on 5 essential tips that are very much needed to tackle the NCLEX RN questions. Here we go. Tip number 1 on understanding the priority questions. Many questions in NCLEX examination will be assessing your skill to answer the most initial nursing actions. So the most initial nursing actions will be the priority answers. So here, when you want to answer this type of questions, you should remember to focus on the best answer, not the right answers. Remember the code MAAS, that is mass. So this will be helping you to answer the questions to a certain extent. What does this mass stands for? M stands for Maslow's hierarchy of needs. Obviously, you would have learned about this Maslow's hierarchy of needs, wherein higher needs take the priority. We know that when questions come, okay, so wherein they ask you to answer what could be the most initial action or most appropriate action, so you should remember that a person to survive needs oxygen to breathe. So always under Maslow's hierarchy of needs, physiological needs takes up the priority. Remember, higher needs take the priority. Physiological needs, following physiological needs, there will be safety, love and belonging, esteem and self-actualization. So always remember the Maslow's hierarchy of needs. And A stands for ABCs. So remember ABC, that is airway, breathing and circulation. Allow your client to breathe. Allow your patient to breathe. This should be your most important priority when you select the answers. For example, here there is a question wherein a client with a diagnosis of cancer is receiving morphine sulfate for pain. The nurse should employ which priority action in the care of the client? You should understand, read, and understand the question first. Okay, so what is the question asking for? So client with a diagnosis of cancer is receiving morphine sulfate for pain. You know that morphine sulfate is a drug which will decrease the respiratory rate. When a person is on morphine sulfate, the continuous monitoring of his respiratory rate is very much essential. When we look into the components of the options, there are 4 options wherein the first option stands for monitoring stools, second to increase or to encourage fluid intake, third to monitor urine output, and fourth to encourage the client to cough and deep breathe. So when you look into these 4 components, definitely 4 options are very much important, isn't it? Whereas, what is the most important action? Which action will be helping the person to survive? The answer is directly the 4th one, wherein coughing and deep breathing will be helping a person's respiratory rate to increase. The oxygenation capacity will be increasing, which will be letting him to survive. So the answer 4 becomes the most important priority. Okay, so the next one is remember assessment. That is, assess before intervening. So you know that when you learned the nursing, okay, so you hope you remember the nursing process wherein assessment becomes the first plan, isn't it? So you should assess to check whether there are any abnormalities, and based on that, then you can intervene. For example, this is a question wherein a client who had an application of a right arm cast complains of pain at the wrist when the arm is passively moved. What action should the nurse take first? Hope you understand. What action should the nurse take first? Let us look into the options. The first option is elevate the arm. Second one is to document the findings. Third is to medicate with an additional dose of an opioid. Fourth is to check for paresthesias and paralysis of the right arm. So when you focus on these options, you understand that the first, second, and third option, the nurse is doing something, wherein she will be intervening with something, isn't it? So whereas fourth option is the only option where we are doing the assessment. So only if you assess for the abnormality, then you can intervene. So remember, before intervening, check or assess. So the fourth option becomes the answer, that is check for paresthesias and paralysis of the right arm. So what are the words that will help you to understand the assessment? So in question, focus on these words. First one is ascertain, assess, check, collect, determine, find out, gather, identify, monitor, observe, obtain information, recognize. Remember, these are the words wherein you will have to focus on the assessment part, wherein you have to take up assessment as the most initial action. Okay, so let us look into the next one, that is safety. Always focus on the safety of patient as well as nurse. So safety based questions may comprises of the things wherein you will have to take up the universal precautions, okay, like standard precautions of wearing gowns, gloves, goggles, shoes, and all those things. So here I have a question wherein a child is admitted to the pediatric unit with a diagnosis of suspected meningococcal meningitis. Which of the following nursing measures should the nurse do first? So the most important thing, focus, like meningococcal meningitis is contagious. So you should focus here on the safety of the patient as well as nurse. So institute seizure precautions, assess neurological status, place in respiratory isolation, and assess vital signs. Okay, so here when you are suspecting the patient with meningococcal meningitis, the most important thing that you should focus is on the safety of the patient as well as nurse. So you have to place the person in respiratory isolation so that the particles do not contaminate the environment. And if so, if the person or if other persons come into contact, they will not get infected with the same. So therefore, respiratory isolation takes up the highest priority. So always remember about safety. Okay, wherein the other options are also important. Seizure precautions, neurological status assessment, all these are important, whereas the most important thing we have to consider is to isolate the patient, that is to place in respiratory isolation. Okay, fine. So these now the second tip is to look for keywords. So I will be explaining you what are the keywords. That is, like when you have an option, at the last part they will be putting these strategic words, or we call as keywords, which will indicate the need to prioritize. What could be the best intervention, or early or late, essential, first, highest priority, immediate, initial, most appropriate, most important, most likely, next, primary, and vital. These are the keywords that indicate the need to prioritize. So remember, if these keywords are present, then your focus should be to select the answer wherein the option has got the highest priority, or the option that you have to consider it as most important thing to do first. Okay, fine. So next, for this, I have an example here. The nurse is caring for a hospitalized client with a diagnosis of heart failure who suddenly complains of shortness of breath and dyspnea. The nurse should take which immediate action? Focus on this keyword, immediate. Okay, so when you are caring a hospitalized client who has a diagnosis of heart failure, and what could be the immediate action? So definitely please understand that here this patient is complaining of breathing difficulties. He's having shortness of breath. So the immediate actions, immediately what are you going to do? So are you going to administer oxygen, or are you preparing to administer furosemide? Are you going to elevate the head of the patient or call the HCP? What are you going to do? So that definitely in order to breathe, elevating the head may takes up the priority, isn't it? So the most immediate thing becomes elevation followed by oxygen administration. So the most immediately when you get this case, so what are you going to do? So these keywords will be helping you to determine, to select the best answer. Third tip is for look for essential words. Essential means, please understand, the options where if you leave it, it will lead, the patient might get into some other complications. Okay, so look for essential. Essential means you cannot leave it undone. Read the question, understand the question, focus on eliminating the options, and focus on the options wherein if you leave that option, the patient might end up in some or the other complication. So always look for essential words, wherein most importantly this has to be done and you cannot leave it undone. If you leave it, it will be leading to some other complication. So tip number 4, eliminate closed-ended words. So what are these closed-ended words? So let us understand what are these closed-ended words. All, always, every, must, none, never, only. So these are the closed-ended words. If your options are having these closed-ended words, most likely you can eliminate those options, wherein you will have to focus on open-ended words. So what are open-ended words? May, usually, normally, commonly, generally. So these are the open-ended words. So here I have an example wherein a client is to undergo a CT scan of the abdomen with oral contrast, and the nurse provides pre-procedure instructions. The nurse instructs the client to take which action in the pre-procedure period? First option is avoid eating or drinking after midnight before the test. Limit self to only 2 cigarettes on the morning of the test. Have a clear liquid breakfast only on the morning of the test. Take all routine medications with a glass of water on the morning of the test. So if you are focusing on the closed-ended words, option 2, 3, and 4 are having closed-ended words such as only, okay, and all. So most possibly you can eliminate these options and focus on the first option. Okay, so wherein the first option is the right answer. Fine. Okay, so what is tip number 5? Tip number 5 is to learn normal values. This is very important. Okay, so only when you know the normal values, if a question arises wherein there could be variations in the normal values, that you will be able to sort it out or eliminate. Okay, for this I have an example. A client with a history of cardiac disease is due for a morning dose of furosemide. Which serum potassium level, if noted in the client's laboratory report, should be reported before administering the dose of furosemide? So 3.2 MEQ, 3.8, 4.2, and 4.8. So you understand that. So this is a question only if you know the normal level of potassium, so you will be able to answer it. Normal level of potassium is 3.5 to 5. So when you focus on the options, 3.2 is the level which is less. So definitely if the potassium level is less, that needs to be reported, isn't it? Why? Because like when we are administering furosemide, this will further lead to potassium loss, because furosemide is a diuretic which will lead to potassium loss also. So nurse, before administering this, definitely if she notes that there is decrease in the potassium level, that should notify. This can be understood only if you learn the normal values. There could be other questions also related to this, where you will have to I'm sure you need to know the normal values of electrolytes like sodium, potassium, calcium, magnesium, and all, wherein decrease and increase may lead to some symptoms. So those symptoms could be given in the question, and you will have to focus on the options where you have to answer, like whether because these symptoms have resulted because of the decrease in this electrolyte or because of the increase in this electrolyte. Okay, so this will help you to understand what to select or what best answer to select. So these were the 5 essential tips that you should know to solve the NCLEX questions. So let me recap. Tip number 1 on prioritizing the questions. Remember ABCs and mass, wherein Maslow's hierarchy of needs takes up the priority role, and the second one is on airway, breathing and circulation, and assessment and also safety. Second tip was to look for keywords. I already explained what are the keywords. Focus on those keywords to determine the best answer. Third option or the third tip is to look for essential words. Okay, so the essential things are the things that you must, in the options you have to select that, and if you leave it, that can end up in some or the other complication. Fourth tip is to look for closed-ended words, so that these closed-ended words you have to eliminate. Most probably that will be leading you to the right answer. And the fifth tip is to learn the normal values. That's all on today's video. Hope you understood the tips, and I believe that you will be applying some of the tips while answering. So see you in the next video. Please like and subscribe. Take care. Bye.